Patient Scheduling Part 2. Interpersonal skills. Convey that patients are your priority, even in online scheduling. Never let the patient feel ignored. Guidelines for scheduling appointments. There are variables. Urgency of the need of the appointment, whether appointment has a referral from another provider, and the recording method for new and for established patients. The recording method for a new or established patient might be the new patient may take a little bit longer versus an established patient. Some more variables: implementation of check-in, cancellation, and rescheduling policies. You want to make sure you have those policies in place so that patients know them. The use of a reminder system, accommodating visits for medical supply and pharmaceutical company representatives, and group schedulings may be appropriate. You want to screen calls. Assess emergency calls before scheduling them. You always want to check with the patient before you put them on hold. Ask them if it's an emergency. If it is an emergency, you need to triage the call. Ask what their concern is, what their symptoms are, their idea of an emergency. Remember, patients, when they're not feeling well, their idea of urgent may not be the doctor's idea of urgent. However, you need to take them very seriously and be careful as to what you say. Ask appropriate questions. Do your best to address the situation. Referral appointments. Give special consideration and schedule appointments as soon as possible. Request patient's record from a referring provider before scheduling if the patient calls for the appointment. Recording information. The patient may be sensitive about giving information. A list of items to obtain from a new patient. The patient's full name, their insurance information, a daytime phone number, the chief complaint, the referring physician if that is applicable. Health histories may be completed online prior to appointment. Some offices still send them in the mail to have the patient bring them at their first visit. A list of items to obtain from an established patient: their name, their chief complaint, and a daytime phone number. Provide a choice of appointment times if available, perhaps evening or weekend if your facility offers those. Confirm your appointment. Scheduling convenient times for patient may be difficult. An appointment matrix. This is a picture of what a manual appointment matrix looks like. There is a manual and there is computerized. Both give current, accurate record of appointment availability times. It identifies doctor's schedule, when people are on vacation, the doctor, holidays, when they're having hospital rounds, and when they're in meetings. Electronic scheduling. The computer searches the database for available time. They confirm the time and date with the patient. Enter the patient's data automatically when scheduling the appointment. When a patient is checking in, a record of the patient's appointment serves as legal purposes. It simplifies tracking of the patient's arrival. Patients must not see names of other patients. That's why the previous lecture on having a patient sign-in sheet is a little touchy in some offices. Patient check-in. Patients may refuse to sign check-in list. Check off patient's name upon arrival. Electronic scheduling provides easy check-off system when the patient arrives. Patient cancellation and appointment changes. Indicate no-shows with a red X. Indicate cancellations with a single red line. Note the no-shows and cancellations in the patient's chart. You want to check with your facility as to what their office policy is on this matter. When there are multiple no-shows or cancellations, you must review this with the provider. The patient may not be committed to their treatment. The provider may decide to terminate the services by sending a certified letter to the patient. Patient cancellation and appointment changes. There's computerized cancellation. It maintains a list of cancellation appointments, and it reschedules if it's appropriate. Some reminder systems. Reminder systems are good because it results in a higher rate of fulfilling appointments. Some of the methods are appointment cards, A telephone call to a patient to remind them that they have an appointment is always a wonderful thing because then the patient remembers in case they might have forgotten to write it down. Maybe sending a reminder through the mail, or if you have email with the patient, sending them a reminder email.